All right, we will go ahead and get started. Good morning, everybody. Just want to welcome everybody back to another one of our Senior Living Education Series seminars. And just to give a high level of what these seminars are, they are designed to help educate, equip, and empower older adults and their families so you can make more confident decisions for later in life. Our goal with these is not to change your plan A, because almost everyone has a plan A and what you would expect to do, but few people have or even think about what a plan B or plan C might look like if something were to happen. So they're just designed to help you think, plan ahead, explore different options, and learn about different resources that we have available in our communities. So few recaps and announcements that we have. We had our Senior Living Community Tour Day where we went and toured Park Center and Hearthstone. So we left from Monroe, and Wesley Life, who is basically the parent company of Park Center and Hearthstone, they provided a bus for us. So we took the bus, that's the start of the day, and we took it up to Park Center. And we got to hear from a panelist of residents who currently live in Park Center. And then Lisa was the moderator for that. And then we went and toured the entire community. So that's just one picture of the library. We looked at 3 or 4 different apartments there that they have to offer. And then from then we had a light breakfast as well, and then a little snack. And then we traveled from Park Center to Hearthstone and had light lunch there. And we toured first the cottages. And then we went, after we toured the cottages, we went to Pella Manor. Make sure I got that correct. And yeah, it was just a good day to explore both of those communities. Here's just a couple other pictures, and then a picture after we got back from touring both of those communities. So just want to thank everybody that came on that. Hope it was valuable, and hope that we all learned something. So quick little recap. And then one other thing, our real estate team also this month hosted a drive-in movie event. And here's just a short 1-minute recap of kind of the things that went on during that. So just a short recap of that event. It was awesome. We probably had, my rough guess is around 80 cars and around 200 people, probably just under. So it's the first time we held the event, and it was really just to show love and support to the community, family, neighbors, friends. So yeah, it was an awesome event and great to have everybody out there in Park Center. And Hearthstone also sponsored the root beer floats. Jersey Freeze came out with ice cream. We had Gateway Church Monroe. A lot of volunteers helped with coordinating bounce houses, and then the touch-a-truck that we had for the kids as well. So the kids love doing that. And yeah, overall, it was just a really good event. Last announcement that we have is, and I'll have a flyer for this, and I'll put it up on the board back there. But so coming up on Monday, October 27th, is the 2025 Senior Life Conference. And so I attended this last year as I was kind of starting to explore just different avenues of where we could take our real estate business and how we could help the community. And I attended this, and this is where I met Mary Eikenberry, and she hosts these same exact seminars in Central Des Moines, and no one else really holds them over here, so I thought it was a good opportunity to do that. So with that, there are, I don't even know how, Shiloh probably can talk more on this, but there's 50, 100 vendors or so that come to the event.
It's great. We have different speakers. It's a great event. Lots of giveaways. It's a Prairie Meadows fundraiser.
Yep, it's at Prairie Meadows. Starts at 8 a.m. ends at 3 p.m. 3:30-ish. Yep, somewhere around there. But yeah, breakout sessions, lunch is included. And then they also, so this year I'm going to be an exhibitor there instead of an attendee. So I'll have a table set up. And with that, I found out that you get four free tickets to just give away. So if anyone wants to go to that, we'll have a sheet back there that you can sign up for it. And then I can give you, if we have more than 4 people that want to go, I'll have to choose randomly. Yeah, if we have 4 or less, then we'll obviously just give those out. But yeah, should be a good time. I would love to see you guys there. It's trying to think what else. It's $10 for registration. All of this will have I'll put this up back there so you can all look at it. But yeah, this has all the information on it, and it's also online as well. So just a note about that. But for today, we can go ahead and jump into today's topic. So I will invite our panelists up, and if everyone just wants to please give a warm welcome to our panelists, Shiloh and Mike. So yeah, obviously our discussion today is going to be about Medicare open enrollment. It's honestly just high level Medicare 101, and I honestly don't know anything about Medicare. I'm going to be learning as much as everybody else is. So we'll go ahead and just dig in to today's topic. So I'll start with Mike, and we can start at the beginning here. So for someone enrolling for the first time, reviewing their plan this year, the big worry is just making a mistake. How can people avoid penalties and make sure that they set things up correctly?
Yeah, so a big thing with enrolling into Medicare, by the way, I'm Mike, I'm with UnitedHealthcare. I'm here in office out of West Des Moines, I'm manager here. But anyway, yeah, that's a great question. I think penalties are always a worry that individuals have, especially when they're new to Medicare. The main thing is to make sure you have prescription drug coverage. That's probably the biggest one that comes up, is there can be a penalty involved if you go without prescription drug coverage. So just make sure that's something you have taken care of. And the best way to do that is to find a local agent, someone who you can trust, and make sure they have your best interests in mind, keeping you on track, doing annual reviews and things like that. So prescription drug coverage is the big one, and the other one would be Medicare Part B. Again, most of these penalty situations where people worry about it is when they're new to Medicare. So if that's a situation you're in, or you know anybody who is coming up on Medicare enrollment for the first time, just make sure those penalty situations are something that they're aware of, and to seek out some good guidance.
Yep. And I apologize, I forgot to do an intro.
No, that's okay.
If you want to do a little bit more intro, you can.
No, I'm fine. Yeah.
And then, so yeah, I'll have Shiloh introduce yourself real quick. Sorry.
Hi, thank you for having me today. I am Shiloh Burke. I have an independent agency, Shiloh Burke Insurance. I work out of Boone, but I do a lot of remote work as well. I'm also on the board for the Central Iowa Senior Education Network, and we would love to have you at our conference later this month. It's a really, really fun day. Lots of vendors, lots of great information. It's a lot of fun. So that's pretty much my info. Yeah, the Senior Life Conference. Yep.
So kind of just to follow up with, I guess, Mike's answer there. So when people know what coverage to choose and things, can you explain the difference between a Medicare Supplement plan and a Medicare Advantage plan, and why the choice matters?
I sure will try. So when you look at Medicare to start, Parts A and B are the base of your Medicare. Parts A and B cover approximately 80% of your medical. And where you want the other 20% covered, as well as your prescription drugs, that's where an independent agent would come in. and the importance of looking at both the pros and cons of supplements and Advantage plans. When you look at a supplement, those are things that you would pay a monthly premium for. It's easy. If someone takes Medicare, you know that your expenses are going to be pretty much covered. Supplements are a great, great option. Advantage plans are also a good option to fill in that 20% hole, as well as your prescription drugs. Some Medicare Advantage plans don't have monthly premiums, which is enticing to people. It is managed care, meaning whatever Medicare Advantage plan you choose, that company will be managing your Medicare. There's pros and cons to that too. They're oftentimes able to offer extras such as some dental, some vision, some hearing, sometimes gym memberships. So a lot of people really like the Medicare Advantage plans that are coming off maybe a group plan, that are used to paying co-payments, stuff like that. So there's definite pros and cons to both. And that's why I think it's so important to talk to someone that can go through, I always say, the good, the bad, the ugly, because there's no one path that's perfect for everyone. What your neighbor may have may be the perfect plan for them, but your plan that would be perfect for you would be completely different because of your network you need, your medications, those types of things. So do you have anything to add to that?
No, that's what I was going to say.
Okay.
What's right for you might not be
Yeah.
right for your neighbor. So everyone, it's all individual.
Mm-hmm.
Yep. And then to kind of touch on what Mike said earlier about the prescription drug coverages, those costs, from my understanding, change from year to year. So how can people figure out what their medication will cost under different plans, and why do those numbers shift?
They can go to Medicare.gov and make an account and punch in your medications and shop around for different plans then. Or again, it goes back to having a trusted agent. I use different programs. Oftentimes clients will just send me a snapshot of their medication list. I'll update it into my system. And then I can do the shopping for them. The plans change every year as far as, we're always getting different medications that are coming out that are going to be in different tiers. A couple of years ago, they did get rid of the donut hole for medications, which was a big relief for a lot of people. Last year, I believe it was a $2,000 maximum out of pocket for medications, which is really great for people that are on expensive medications like Eliquis or something, that were paying much more than $2,000 for their medications in a year. I believe in 2026, isn't it 2,100? Yeah. So it just, the tiers change. If there's a generic offer that may not have been offered last year in a formulary, and this year we do have it in a formulary. So it just changes every year. So that's probably the most important thing to check every year, your medications.
And then for Mike, I guess if once you have prescriptions and things lined up, a question that could pop up is, will I be able to see my doctor? So how can someone make sure that their doctor is in network before they actually commit to a plan?
Yeah, there's a lot of tools that are out there available to members or people that are on the plans, as well as agents. And again, that is critically important to get, especially in your community, if you're going to travel, whatever that might be, to ensure that your doctors are going to be in network. So a lot of plans, I know I work for UnitedHealthcare. I'm assuming other companies might have similar tools. A very popular one that is becoming more and more utilized are apps on your phone. So UnitedHealthcare, I know, has a very popular app on their phone where you can search doctors, look up to ensure that you're going to find the care that you need that's in network, because that is very important, especially if you're traveling, whether it be for an extended period of time. Obviously, you may have some lab work or some type of routine care that you need to get taken care of. One thing to keep in mind, though, whether it's on a Medicare Advantage plan or supplement, if you are traveling, emergency and urgent care is going to be covered worldwide. So that is something to be aware of as far as traveling. You don't have to worry about going out of network or to a facility that's not going to cover your situation if it's an emergency or urgent care situation. So, and then lastly, I think some of those tools, if you're not comfortable using them, like you said, find a trusted agent, someone that you can work with. That I can't stress that enough. Just like any industry, there's good and there's bad agents. So if you have an agent now and you haven't heard from them for a while, don't be afraid to go shopping for an agent too, because that is a key piece in ensuring that you're going to be taken care of the way you deserve.
And then to, I guess, follow up as well, transitioning over to premiums and out-of-pocket costs. A lot of folks see Advantage plans with a $0 premium and wonder like how that works exactly. So how is it possible that some plans have no monthly premium, and what should people know about out-of-pocket costs?
Yeah, that's a really good question that comes up a lot. It's, you might see something that has a 0 premium and think, this is too good to be true. How can this be? It's a scam or whatever, And it's really not the case. Medicare is a government program. So I know every paycheck that I get, every paycheck that you guys have had throughout your careers, there was a line item on there where there's a Medicare tax. So those dollars are going into a big fund of Medicare for the federal program. And then Medicare Part B has a premium. So you're paying that Medicare Part B premium. All those dollars go into the big bucket of money under the federal program of Medicare. When somebody turns 65 or they become eligible for Medicare, now the federal government, through the Medicare program, is responsible for your health care. So Medicare Advantage plans are managed by private health insurance companies. The plans that they have to be approved by the government, by Medicare, but it's a private health insurance company. So when somebody signs up for a Medicare Advantage plan that has a 0 premium, the federal government, the program of Medicare, gives a set amount of dollars to that insurance company to manage that person's care. So again, and then as you use the coverage, you get to pay a copay or a coinsurance or whatever for that particular service. And then Medicare supplements work a little differently, where you're going to pay a premium up front, whether you coverage or not. You're paying the premium, and then when you go, typically you're going to have very low or no costs as you go to the doctor. So again, it sounds something 0. Again, nothing's free. You've essentially already paid for it through your taxes and your Part B premium. So again, it is a common question that how can this be? But it is definitely a legit program to have those 0 premiums.
And then Shiloh, if you want to follow up on, if you have any thoughts on that, and is it accurate to say that one person could be paying copays while another person doesn't have to if they live in the same community or region?
Yeah, there's all different plans out there. When we look at supplements compared to Advantage plans too, one way that I like to equate it to my clients is on a supplement, if you think of that as a gym membership, if you pay for a gym membership, you're going to pay that monthly fee whether or not you walk into that gym. Whereas if you're on an Advantage plan, you may not pay that monthly premium, but you will be paying co-payments depending on your plan. It ranges. Some of them $0 co-payments if you see your primary care. Others you have to pay $5 or $10 just depending on the plan. So when I hear people say, well, my neighbor's plan, they don't pay anything. Well, they're paying one way or another. You're going to be paid, whether it's a monthly premium or in the form of co-payments and maximum out of pockets. And that's another thing. I hear people say, well, I don't need an Advantage plan. I have parts A and B. I don't need anything else. That 20% that A and B would leave you with, who knows how much that could be. With an Advantage plan, it caps your responsibility. So that's something to consider too.
Yep. And then thinking about when plans change and like the extra items like dental and or vision, what is the best way to see what's included in a plan, and then how do people compare those benefits?
Definitely. So definitely, I always recommend finding yourself an independent agent that can compare and do the research. Myself, I do a lot of research leading up to this time of year. I talk to hospital administrators, find out what plans are working well with them. If they're having unhappy patients with certain plans, I want to know about it. And I always tell people, don't ever pick your plan by the bells and whistles. The bells and whistles are great, but make sure you pick the plan that covers your medications the best, the stuff that you have to have and that you know you will use. That's the important part. And this is all just my opinion, but in my opinion, that's the important stuff. And I do all the comparisons for people, and your agent should be doing that too. And it's just very important to look and compare every year.
And then, Mike, you did touch on this earlier about traveling and being out of state, and you brought up a comment about that. How can someone make sure that their plan still covers them while traveling, in addition to what you mentioned before?
Yeah, I think I don't have a whole lot more to add on that. I think, like I said, if you're going to be heading out of town for a week or two, you don't have any, obviously make sure you have your prescription drugs and everything like that ready to go with you. Another important thing, again, with all these plans when it comes to prescription drug is there are networks. So make sure, if you're traveling, there's a pharmacy that's going to be in that network. But at the end of the day, if you're, just a couple week or two trip that you're going on, just, make sure you're aware of that emergency urgent care, you're going to be fine. The carriers are required to cover those types of visits. If you do, say you head south for the winter to a warmer climate or something like that, then that's where it's going to be very critical to make sure, any of those specialists that you might need to see or, monthly or type of visits that you might have, that there is a provider or a doctor in that area that's going to see you, and then you're not getting that surprise bill finding out that this particular doctor was out of network. So again, with all the carriers, and that's, again, we've said this a lot, having an independent agent, I think, is very important to help you out because they can help you with those tools to ensure where you're going, you're going to be covered.
So with open enrollment season kind of coming upon us, and we had a seminar about scams 2 or 3 months ago. Obviously people are going to be getting a lot more telemarketing calls about Medicare, and I guess any thoughts or 2 cents on how they can understand and know what's real versus what's a scam?
Yeah, it's really hard to know what is real and what's a scam because the scammers are really good at what they do. So just be very leery. I wouldn't sign up for anything. I would not give any information over the phone. I hear about this a lot where almost every time when this happens, almost immediately when they hang up the phone, they know they did something wrong, right? So like, I think I signed up for something, I don't know. And then they call me or their agent and they say, I did this, and everything has, they're either, hopefully, it shouldn't be stuck, whether there's usually ways to back out of those things. But again, whether it's somebody calling you, trying to get information, just hang up the phone, don't talk to them. The other thing, and this time of year, because we're in the annual enrollment period, which starts on October 15th through December 7th, you might have people knocking on your door, things like that. Again, find someone you trust, an agent that you trust. If you get that phone call or anything like that, just don't even deal with them. Deal with your local agent that you have a relationship with that can help steer you in the right direction, because it is very hard to decipher what is a scam or not. So again, just err on the side of caution and just do not deal with those individuals.
Yep, hang up on them.
Yep.
And anything, I guess, question for both of you guys, anything that's coming up in this open enrollment season, I guess if that's what you call it, that people should be aware or be paying attention to?
I guess one thing I would say is, if you're on a current plan or you're going to be shopping around or whatnot, just know that you're probably going to see some higher costs out there. At the end of the day, there's a lot of pressures going on. Like I said before, Medicare is a government program, and there's just there's just a lot going on with the Medicare program and the government in general. Inflation has been a big deal that hits every industry, whether it's your groceries, and it hits healthcare costs as well. So costs of care have gone up tremendously. And then just, utilization. Again, we've had more advancements in healthcare in the last 10 years than probably the previous 200. There's so many more procedures and things people are living longer. So it creates a lot of pressures on in the insurance companies. I work for the company, and it's easy to blame the evil insurance company, which they're not always on the up and up either. So they need to correct some things as well. But there's just a lot of costs that are out there. So just be aware, like Shiloh said, chasing those bells and whistles and, finding, something that's going to, alleviate something from the short term may not be the right answer for the long term. So just be aware that is out there. There are a lot of increased costs when it comes to choosing a plan as well. And so it is what it is.
Yeah. Any other 2 cents on that?
Make sure to be on the lookout for your annual notice of change. That should be coming in the mail if you have not already received it. That will go over plan changes for this year. We have seen some plans exit the market. So if your plan did exit the market, you need to make a change before December 7th to make sure that you do have the coverage. So just make sure that you do read the mail that's coming in from what insurance company you use. And then I always tell people this is a great time of year to make sure you have an updated medication list from your pharmacy. If you can get a printout from your pharmacy, that really helps your agent a lot too, to make sure that they're putting in your medication correctly when we shop for plans for you.
Perfect. I think that's mainly all of the questions that we had. Do you guys have any other just pieces of advice? And then we'll open it up to quick Q&A session.
Yeah, we've mentioned, again, independent agents a lot. Shiloh works with you all, with Medicare beneficiaries. Again, I work with the company, so you would be Shiloh's client. Shiloh is kind of my client. So, like I said, if you don't have an agent, or if you haven't heard from your agent, again, I work with a lot of agents in my role, and I can tell you that Shiloh does a tremendous job. So she didn't tell me to say that at all. Trust me. So if you are looking for someone to do a good comprehensive review of your plan, I couldn't recommend Shiloh enough. She does a wonderful job. I know she has some cards back there, and you do have a little bit of time here before the first of the year. You have through December 7th to make your final decision on what your coverage is going to be for 2026. So you don't have to make a decision today, but you can mull it over, and don't be afraid to reach out, because again, I know she does a really good job with her clients.
Thank you. Yeah. Just like I said, that medication list is very important. Get that prepared for your agent. That's going to be a huge piece of the puzzle, especially if you're on expensive medications. We want to make sure that whatever plan you choose, everything you need is in your formulary. Please just hang up on telemarketers. Just hang up. Make sure that you're choosing your agent. Don't let them choose you, because you want to choose someone that has your best interest in mind. And I think this year we're seeing it more than ever, with some plans exiting the market, with some plan changes, the importance of having a good, solid agent that will really do the research for you and shop around. I think this year, my role is more important than ever for the clients, because we're seeing so many changes, and they're not all bad changes. We'll make it through. I know in a few Facebook pages that I follow with Medicare agents, people were pretty upset this year. It's been pretty stressful, but it's going to be okay. But we're going to be okay. It's just a tumultuous year of changes. So, yeah.
That sounds good. Does anyone have any specific questions? Yep, Shirley.
I would like to use the pharmacy during Monroe, but it's not in my network. How do I find out what I need to do to have someone that includes that in the network? How do I find that?
So if you go to Medicare.gov, you can put in your medications, and I believe there's even a spot to put in your pharmacy, and then that will spit it out for you. Am I right in that?
Yeah, there are search tools, again, that can be. I would also talk to your pharmacy and ask them why they're not in the network of that particular plan. There could be a reason, but there also is a process where that pharmacy can reach out to the insurance provider, insurance carrier, and take the steps to become in network. So I would talk to them as well and say, hey, I have this company. I would love if you were in network, could you reach out to them, and then kind of put it in their hands too.
Good question.
So the different tiers have a lot to do with medication costs. And are they brand name? Are they generic? When we look at tiers, tier 1 is usually going to be your less expensive medications. Where tier 2, you're kind of getting to a little bit more expensive medications. Tier 3, 4, and 5, those are going to be your real expensive medications. And that's why the co-payments for those are different. Do you have anything to add to that?
Yeah, I'd say too, and every company has different formularies. So what company A might say this particular drug is a tier 2, and the next company might have that same drug as a tier 4. It can vary. Each company evaluates their prescription drugs and puts them on the tiers, not only based on cost, but also based on how effective they are. So if they think that this particular drug, even though it may be cost a little more, if it's very effective and it works, they might want that drug on a lower tier. So usually another thing is a lot of those drugs that you see on TV, the commercials and things, those are typically your higher tier drugs, your tiers 3 and 4, things like that. So a lot of times there might be a generic that equivalent that could be used. So yeah, just be aware of that. And so again, those tiers, it varies from company to company on what they determine would be a tier 1 or 5.
Go ahead, Jim. Let Noel go.
Can you actually shop or person shop on Part B? The reason I ask is because we have an agent in Altoona who does a very good job for us. But then I have home, auto, and health with the national organization. And they said we can save you a whole bunch of money on Plan B. And are those rates standard, or are they just, giving me a line on that?
You said B as in boy?
Right.
Those are
That's through
those
the
are-
government.
yeah, those are pretty set rates
Yeah.
through the government.
There's
and-
the IRMA, the income related monthly adjustment. That would be really the only reason why a Part B would be different is it can go off of your income, but that would have, I think.
Yeah, no, that's a good point. That could have an effect on it, but those rates are set by the federal government as far as what those are. And in fact, we should probably know here in another couple weeks if there's an increase, which there probably will be for the Part B premium.
If your trip happens and you just go to the hospital, how do you coordinate all that? Do they just call our agent back home and?
So again, Medicare is a federal program for the United States. So the plans will cover emergency and urgent care worldwide. So if that situation were to happen, and it does happen, the claims process, it could be a situation where, maybe you have to pay some out of pocket. On emergency and urgent care, it will work itself out. It could be a lot of red tape to go through to finally get the end resolution. If you're going to, and this does happen, say someone goes to Canada or Mexico for some procedure that they hear about is, less expensive. Medicare is not going to cover that because it's a United States program. If someone were to be traveling and you're worried about something, there are, supplemental type products that you could purchase for a short term, worldwide coverage, but you wouldn't be getting that through anything through your Medicare plan. That would be a separate plan or product that you would need to research and find.
Yeah, I hear that. President Trump said that he's looking at a deal with Pfizer, getting those prices in Poland.
Me? Also, another thing for the out of country travel, this is just my own little personal opinion here, but my daughter and I just went to Europe a few months ago, and I definitely bought the medical insurance. I want to say it was $100 for both of us for the whole week. We booked ours through Costco Travel. I did get actually really sick. I ended up not having to go to the emergency room, but I will say that night when I had a fever, and I do remember thinking, thank goodness I bought that extra insurance just in case, because oftentimes that extra insurance that can cover plan or, trip disruption. It can cover if you have to be transported, those types of things. So I do recommend, talking to your travel agent about it, anything like that, when you do book a trip, to see what's offered if you're leaving the country, because it is going to be minimal what your coverage is through any insurance. I have federal employee insurance. My husband's a federal employee, and I would have also been limited on how much my coverage would have been. So I do recommend that personally. So, yeah.
Did you have a question, Harriet, or no?
No, I'll talk to them later.
No, perfect. Any other?
I was just wondering, does Medicare Advantage, do they cover like surgeries or things like that?
Absolutely. Yes, they would cover necessary surgeries.
What if you had like that zero? You haven't paid zero, and then you have to, pay $7,000 for surgery, so they cover that.
Well, so how oftentimes Medicare Advantage plans work is it's very similar, I would say, to the insurance that you had before you turned 65 and went on Medicare, where you may see a deductible for major medical. You may see if you had a surgery at an outpatient facility, maybe it would be $450 would be your cost. So you're just going to be paying co-payments, co-insurance, those types of things. Very similar to what you had before you went on Medicare.
Anything that's medically necessary,
Yeah.
they will cover.
Yeah.
Anything that Medicare, because these plans, Medicare Advantage plans have to be approved by the federal government. So if Medicare covers it, the Medicare Advantage plan will cover it. Now the Medicare Advantage plan could then, they're going to charge a copay, but like Shiloh said, Medicare Advantage plans have a cap. There's a maximum out of pocket on the Medicare Advantage plan. So even if the surgery is $100,000, you will not spend more than what the cap on the plan is, and a lot of times that can range from $3,500 to $8,000 or whatever. So depending on that plan, but you'll have a set copay to get that procedure done.
Yeah, and that doesn't mean that you would automatically have to pay the first $3,500. You would have possibly a deductible and then your copayment. So what was the average? Was it 2% of people ever meet their maximum out of pocket? It was a very, very low percentage that meet their maximum out of pocket on Advantage plans. So, but it is something to be aware of. And I always make sure when I meet with clients that are thinking of moving from a supplement to an Advantage plan, they see those $0. And I do recommend making sure that you understand if you have a surgery, you will be getting a bill probably if you have a Medicare Advantage plan. So be prepared for that. This is not a free, it's not a free plan. So it's just something to consider and be prepared for.
What percent are in an Advantage plan? Is that increasing now?
We have seen the numbers increasing. Mike, you probably know that better than me.
So on a national level, it's been growing. Advantage plans have been growing very quickly over the past 8 to 10 years. On a national level, just last year in 2024, it just went over 50% of Medicare beneficiaries on a Medicare Advantage plan. I think this last year it was like 52 point something. So it actually is, Advantage plans actually on a national level are more popular than Medicare supplements. In Iowa, I want to say it's creeping up to around 40% of, that's not an exact number, it's right around there, around 40% are on Medicare Advantage versus 60% either still on original Medicare with nothing or a supplement. So.
Can you go back and forth, like between the Medicare Advantage 1 year and then supplement, just like you don't like it?
That's a great question. So when you look at supplements and Advantage plans, to move from, say that I'm someone that's been on a supplement for 10 years and I think, I think I would like to try an Advantage plan this year. So you get a 1-year trial right period where you could try a Medicare Advantage plan. And within that first year, if you decide an Advantage plan is not for me, at that point you can get a special enrollment period and you can go back on a supplement without having underwriting. After that 1-year trial right period, you would be subject to underwriting unless there's certain circumstances. Like this year, we saw some plans exit the market. If your plan's exiting the market, you would get a special election period that you could go and do a supplement without underwriting. But generally, everyone gets a 1-year trial right period to try an Advantage plan where they can go back to a supplement without underwriting. After that 1 year, they would be subject to underwriting. So.
What does underwriting?
Oh, underwriting means that they could ask health questions and determine if that supplement plan would want to accept that application or not. So they would add, have you, in the last 5 years, have you had cancer, heart disease, whatever. I don't know what the exact questions are, but they can ask medical questions to determine if, one, they're going to accept you as a member, or two, what your rate would be. They could you could get, there's what are they called?
Standard.
There's standard rate, preferred rates. There's preferred rates, or they can charge you more on a monthly basis to have that plan. And then the other thing I would say, as far as switching back and forth, that you would need to be aware of the enrollment period. So right now we're in the annual enrollment period. This would be a time where you could sign up for an Advantage plan and start that 1-year trial right. Whereas if you're in the middle of the year, usually that's kind of cut off unless you have a special circumstance where then you can sign up for an Advantage plan.
One more thing I would add is also during annual enrollment period and open enrollment period, you can switch from Advantage plan to Advantage plan without underwriting. So if there isn't underwriting, you have to do it during certain times of the year. If there is underwriting, you can do it throughout the year. But Part D plans do not have underwriting, and Medicare Advantage plans do not have underwriting.
So so you're talking about if you use a supplement plan and you use Advantage.
So supplement plans, we'll say a Plan G, that's a pretty popular plan. That would cover the 20% that plans A and B do not cover. You would have a Part B deductible. I can't remember the exact amount. It's a few $100s, but that you would be paying a monthly premium for. Like I said, that's kind of like having a gym membership where you pay a monthly fee whether or not you step foot in a hospital. You know what your medical costs are going to be. Where an Advantage plan, oftentimes they have low premiums or $0 premiums, and then you have co-payments, and those medical co-payments all go in that maximum out-of-pocket bucket. And like Mike said, that can range from $3,500 to $8,000. So you still know what worst case scenario is. There's just some potential savings for a lot of people under Medicare Advantage plans. So yeah.
Montessa, did you have a question?
Yeah, mine was just really about the Senior Life Conference.
Yeah.
I was just curious about what types of vendors will be there, speakers, history.
Yeah.
Just curious
I've
about
been on board a couple years on the Central Iowa Senior Education Network. We put on this conference. We used to do it twice a year. We've back down to once a year. We're back at Prairie Meadows. We have lots of different vendors ranging from insurance companies to senior housing. We've had the tech tutor come in before she's spoken. This year, we try to have different speakers from different areas, whether it's, a healthy living series and then maybe an insurance side. Oftentimes we'll have someone from the VA there talking to veterans about different things that are available for them. Usually SHIP usually is there answering questions. There's also realtors usually are there if you have questions about downsizing, stuff like that. We have other board members that are from all different businesses that cater the senior population. If you have questions about investing, retirement services, we have someone from that. We try to have just a wide array of vendors there to really go through all your options of things that you may need.
So what is it called again?
It's the Central Iowa Senior Education Network. And then it's CISEN, CISEN. So, yep, there's a flyer here. Yep.
We'll have a
Yeah.
we'll have a flyer. We'll send it out. And just, yeah.
I'm sorry.
Nope, go ahead.
Would you explain, We have Part F, if you said Part G.
Yep.
Plan to, could you explain kind of-
So F and G are very similar. F, you do not have the Part B deductible of a few $100s. Part G, you do have the Part B deductible of a few $100s. So like I said, when you look at A and B, that covers about 80% of your medical, and then F would cover what A and B do not of your covered medical expenses. And that's what you're paying that premium for.
Perfect. I think that all sounds good. Any other last minute questions? If not, we'll just go ahead and wrap up. Thank you both for just joining us.
Oh,
Um,
yeah.
I'm sorry, I do not quite understand it. Okay, so it was A and B, Part A.
Yep.
How do you explain Part A, what that means?
So Part A is through the government, and that should be on your red, white, and blue card that you have for Medicare. And A helps cover the hospital. Oftentimes, that's a $0 premium for most people. Part B, you do pay for through the government. A lot of people have that come out of your Social Security.
And they'll be here afterwards as well to be able to explain
Yeah.
those questions in more detail. But yeah, if you want to give them a round of applause and just thanks for your time. Just a reminder for our November seminar next month, we will be doing a senior living community panel. So it'll be both of our education partners. And then I think we're going to have Vicki Monaco, who was going to be on the previous panel with us, and she wasn't able to. I think she's going to come back, and she does things inside of financial services. So to give a perspective on that. And then, yeah, I guess one other note about the Senior Life Conference. I did attend it last year. There was only one other realtor there, and they had not gone through the Senior Real Estate Institute from what I know. So I believe I was certified on like at the beginning of this month and got my designation or whatever to be a certified senior housing professional. So I got through all of those classes. So I was excited to get all that stuff done. But yeah, it should be a good event, and I hope to see everybody there. So thank you, everybody, for coming. And if you do have any specific questions, feel free to ask Mike and Shiloh. They'll hang out for a little bit and be able to answer any questions for you.
Let's reach out to